Welcome to the MamasteFit YouTube channel. In this 15-minute core workout, we're going to be learning how to engage our core, start on the floor, and then move to more upright core exercises to help strengthen our core both during pregnancy and for the postpartum. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and now mom of 4. So I am currently on my 4th postpartum journey with rebuilding my core after birth. And so I want to help you know how to train your core during pregnancy, help recover it in the postpartum, because there's a lot of exercises that we can still do that are safe for our core and for our pelvic floor. In this workout, we're going to start down on the floor with a breathing exercise so we can learn how to engage and activate our core. We're then going to take the concepts that we learned in that breathing exercise and start with some floor-based core exercises so that we can learn how to coordinate breath to movement, which means we are breathing and managing pressure within this space as our arms and legs are doing things. Following that, we're going to move into 2 rounds of standing core exercises, which are going to be more of our functional core movements. So how we can integrate our breathing, our core stabilization into more upright functional movements is kind of the progression of today's workout. And if you enjoyed today's workout, be sure to check out our online prenatal and postpartum fitness programs because we incorporate a lot of core strengthening exercises that you can do that is, again, safe for pregnancy, safe for the postpartum, because we do still want to train our core in both phases of life. The equipment that you'll need for today's workout is going to be some medium to heavy weights, both for the floor-based exercises and for the standing. And you can also add in a long resistance band that's attached around knee level, but this will be optional. So once you've got your equipment, let's go ahead and come down to the floor to get started with our diaphragmatic breathing. So we're going to start on the floor in a comfortable seat. If you find sitting in hero's pose is not comfortable, you can also sit on a yoga block or even just sit down in a chair. Place your hands onto the side of your ribcage, and we're going to learn how to diaphragmatically breathe, which is how we're going to manage pressure and engage our core. So we're going to start by taking a big inhale into the hands. Feel the rib cage kind of push out to the side. And then I want you to think about your backside body kind of pushing back as well. And then exhale, think lift up in the front half of the pelvic floor and pull belly to spine. So big inhale into your back. Exhale, think lift up in the front. And then just continue with this breathing pattern. So we're thinking that the back side of our body is expanding and kind of pushing out, and then the front side kind of lifts up and in as we engage. And so for a lot of us, the back side of the body tends to be a little bit tighter while the front side tends to have more length. And so doing this type of breathing can help kind of engage muscles that are kind of lacking in engagement and stretch ones that need a little bit more. So let's go ahead and start with those floor-based exercises. So we're going to start in a side lying position where my elbow, hip, and ankle are on a generally straight line. And then think rib cage is aligned to the pelvis. And now remember that breathing pattern where we breathe into our back and exhale to lift into the front. Exhale, push both hips forward so we have full extension in both sides, and then inhale to sit back. So exhale, think lift up and pull belly to spine, and inhale, think breathe into your backside body. As you exhale, you can also make like a shh type of noise, which is going to help kind of engage the core a little bit more. So now go ahead and hold this position. You can either lift that top leg. We're going to just maintain this side plank. If you want, you can pulse that leg, and then we're just breathing here. So big inhale into the back. Exhale, think pull belly to spine. Let's go ahead and switch to the other side now. So elbow, hip, and ankle in a generally straight line, knees out in front. And so we're going to exhale to push both hips forward and then inhale to sit back, really thinking about that breathing pattern. Exhale, push the hips forward. Oh, you can think almost tuck the butt underneath at the top. Both hips are extended. Inhale to sit back. Exhale with that shh type noise to help engage the core. Inhale, back. And now hover in that top leg, maintain this position. You can pulse the top leg if you like, and we're just going to breathe here. So big inhale into your back, exhale, pull belly to spine. And then think about the ribcage position. We're not arching in the back. Ribcage is still staying aligned to the pelvis. Now let's come to a tabletop position. We're going to do our bird dog. And so we're going to put weight into one hand and then the opposite knee, and then exhale to extend in the opposite side. So we're going to put more weight into one palm and then to that opposite knee. So you can slightly hover in the opposite sides, and then exhale to extend. Keep that engagement between the pelvis and rib cage, and inhale to come back. As you extend, we're avoiding arching in the back, so keeping that engagement in the core. If you arch, you'll probably feel more of a stretch, and you'll feel your core kind of turn off as well. So exhale to pull those 2 points together. Inhale, come back. Let's go ahead and switch sides. Exhale to extend. Keep that engagement in the core. Avoid arching. Inhale, come back. It doesn't matter how high you lift the foot up. It's more about how high can you get while maintaining that core activation. So let's go ahead and come back onto our side to do that side lying hip abduction again. So elbow, hip, and ankle in a generally straight line. And this time we're going to extend and we're going to hover in the ankle as well. So make it a little bit more challenging. Rib cage and pelvis are aligned. Exhale, push those hips forward, spread knee and ankle apart. Inhale to sit back. Now extend that top leg, and then we're going to bring elbow to knee and then reach overhead. So everything's kind of coming to the side, not to the front. And as you reach, avoid arching in the back, so we're still keeping that engagement on the front side of the body. Let's go ahead and switch to the opposite side. So during pregnancy and the postpartum, it can be really helpful to focus more on the side abs in those positionings, because focusing on the front can sometimes hurt the core a little. Exhale, push the hips forward, spread the knees and ankles apart. Inhale to sit back. So we can still train our core during pregnancy by focusing more on these lateral or side plank type motions, cross body motions, rotational ones, as opposed to more of the abdominal flexion like sit-ups and crunches. When we do more flexion-based exercises, it can sometimes cause abdominal coning, where the center of the abs push out a little bit more, and that could potentially damage the core. And now we're going to reach overhead, bring elbow to knee. But strengthening our core during pregnancy is still important because it helps to support our baby's position, it helps to support our comfort, and then it's equally important in the postpartum because it helps to support our overall function. This is how we anchor movement. Now let's come to our tabletop position for our bird dog, grabbing on to your medium weights. Now when I do this variation, I'm going to row as I extend the opposite foot back. So put a little bit more weight into one hand and one knee. Exhale to extend. Inhale, come back. And we're still engaging in the front side of the body. I'm rowing back to form a 90-degree angle with my arms, so I'm not pulling to my shoulder. Let's go ahead and switch sides. Exhale and extend that foot as you row and avoid arching in the back. Let's go ahead and place those weights to the side, and now we're gonna come to a standing position. So go ahead and grab onto those weights, and we're gonna bring them to a front rack carry. So I'm gonna hold the weights up in front of me, or you can bring them to your shoulder. And then we're going to march in place. So begin to drive one knee up, hold here for a second or two, and then switch to the other side. So when we design core training programs that support pregnancy and the postpartum, our main focus is to ensure that the exercises are not going to damage the core by causing any sort of abdominal coning, where the center of the abs push out a little bit more than the rest of the abdominals, because that could potentially damage the core. And so we want to focus on anti-movements, like the farmer's carry, peel-off press, movements where we're resisting movement. So we're trying to not move in it. So in the farmer's carry, I'm maintaining my upper body position. I'm not swaying from side to side as my arms and legs do things. Let's go ahead and take one band, place it around the inside of the knee, and we're gonna do 2 movements on this side, and then we'll switch to the other side. So grab one of your weights. We're gonna do an upward chop. So we're gonna come down to a half kneeling position. Knee is down, weights towards your knee, and then exhale to rotate up. If you're using the band, you can kind of drive that knee in as you reach up with that weight. The next core movement that we can do for pregnancy and postpartum can be the rotational movement. So integrating those obliques to help strengthen the core. Let's come to a standing position. Place the weight just on one side. Inhale, lower down. Exhale to come on up. And the third movement that we can incorporate into our core training is going to be our hip extension exercises. So we're extending in the hip while maintaining our upper body position, and I'm adding a weight to one side to make it a little bit anti. So let's go ahead and switch sides now. So let's come into that half kneeling position, and we're going to rotate to bring that weight up. Exhale, rotate up, inhale, back down. So we're gonna go from this upward chop straight into that one-sided squat. Bring the weight to the outside shoulder. Inhale, lower down. Exhale to come up. So there should be tension in that band. You should be resisting a pull out of that knee. And we're trying to keep the torso up and down in the center, so we're not leaning towards or away from the weight. Let's go ahead and grab onto both weights to do our final round with that standing march. So if you want to do an extra round of any of these exercises, feel free. Bring the weights up to your chest or to your shoulders, and then begin to march in place. So the 3 types of movements that we can incorporate into a prenatal or postpartum training program to help keep the core safe, while also strengthening it, is going to be those anti-movements So we're resisting rotation, resisting lateral flexion, we're resisting movement in the upper body to help it maintain its position. So it's not necessarily like an isometric movement like planks. We're still moving the arms and legs, but we're maintaining the torso position. We can then also incorporate rotational exercises like the upward chop, which is gonna help to strengthen the obliques and side abs a little bit more. And then we can finish up with our hip extension exercises where we just load it on one side. So we got our one-sided squats, lunges, a little bit of anti-lateral flexion as well. Go ahead and place one of those weights down and grab onto your long band and place it around the inside of the knee. This helps to turn on the inner thigh a little bit more, which helps to strengthen the core. So the adductors are part of our second layer of core and really important for pelvic stability. Exhale, rotate up, inhale, back down. And so we program core training workouts like these into our prenatal and postpartum fitness programs to help you stay strong and comfortable throughout your pregnancy, help you rebuild your core postpartum. So now take that weight, put it on the inside arm. We're gonna go ahead and inhale, lower down, exhale, come on up. So as we go up and down, we're trying to maintain center so we're not leaning to or away. We're not twisting in the body as we lower as well. Let's go ahead and switch to our final side. Band is on the inside of the thigh to help turn on that inner thigh. Come into your half kneeling position. And as you exhale, you can kind of drive that knee in as well. Exhale, rotate up, inhale, back down. Let's come to that standing position. Weight on the inside arm. Inhale, down, exhale up. And we're trying to maintain center. So we're not leaning in either direction. We're also not twisting in the hips. Let's go ahead and place that weight down, and this concludes today's core training workout. So in the workout, we started with that diaphragmatic breathing to learn how to engage and move our core, help manage pressure, and to help improve its function. We then moved to some floor-based exercises to integrate that breath to movement. So we're learning how to breathe while also starting to incorporate a little bit of movement in a supportive position. And then we finished up in some standing movements for more of those functional core exercises to kind of continue on what we've been learning so far. I hope that you enjoyed this workout and it helped to strengthen your core and get an idea on how to activate it. Definitely check out our podcast episode where we break down core training during pregnancy, the postpartum, and check out our online prenatal and postpartum fitness programs. We incorporate all the core training for you, so way more than what we included in this one single workout because there's so many exercises that can help you feel comfortable and strong throughout your entire motherhood journey. You can check out all of our fitness programs on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online offerings. We also now have these ultimate bundles where it includes both pregnancy and postpartum fitness plus all our most popular courses where you can save an additional 15% off for a total savings of 25% off all of these amazing courses. So check them all out on our website at MamasteFit.com. And thanks so much for working out with me.